Personality Disorders by Anna Stedman, Janelle Rogers, Brady Ingram, and Opulence Benton. Occupational therapy is important in mental health because occupational therapists are considered mental health providers per AOTA guidelines, which means we provide treatment and interventions to those with a mental health disorder. It is interesting to note that roughly 2% of occupational therapists work in what is considered a mental health field. Cluster A is often referred to as the odd or eccentric cluster and includes paranoid, schizoid, and schizotypal personality disorders. This cluster is characterized by distorted thinking and can result in social awkwardness or social withdrawal. Paranoid personality disorder. This is characterized by severe distrust with other individuals and feels as if others are motivated to hurt him or out to get him. Onlookers might consider one with paranoid personality disorder as argumentative and hard to calm down. Schizoid personality disorder. Those diagnosed with schizoid personality disorder are considered to be severely introverted or socially detached from others. They tend to exhibit talent in areas of mathematics. Socialization can be difficult and one can be viewed as apathetic. Schizotypal personality disorder. This includes having magical beliefs such as superstitious beliefs that one can read another's thoughts or believe one's thoughts are being stolen. They exhibit odd speech patterns, dress, and mannerisms.
Cluster B is known as the dramatic, emotional, or erratic cluster. It includes antisocial personality disorder, histrionic personality disorder, and narcissistic personality disorder. Individuals with these disorders all struggle with impulse control and emotional regulation. Antisocial personality disorder is characterized by hostility and aggressiveness towards family and peers. There is a direct disregard for others' rights. Individuals diagnosed with this disorder often take part in crimes such as arson and theft. Individuals diagnosed with this disorder have presented symptoms since the age of 15. Borderline personality disorder is characterized by engagement in self-harm, suicidal attempts, unstable relationships, fluctuating emotions of anger and loneliness, and seeing the world as black and white. Narcissistic personality disorder is characterized primarily by a sense of grandiosity, exaggerated self-worth, and lack of empathy and patience for others. Individuals may also have fragile self-esteem despite their grandiose sense of self. Cluster C includes avoidant, dependent, and obsessive-compulsive personality disorders, or OCPDs. Some common symptoms include feeling anxious or fearful. Avoidant personality disorder is characterized by a pattern of social inadequacy and hypersensitivity to any criticism. Individuals with this disorder want to have friends but avoid any interpersonal contact. They may perceive themselves as socially inept or not good enough. Individuals may experience major social and occupational dysfunction due to hypersensitivity and low self-esteem. Dependent personality disorder is characterized as having an excessive need and desire to be taken care of that leads to submissive and clingy behaviors. Individuals allow others to take initiative and agree with whatever their caregiver says. Individuals may also have difficulty advocating for themselves. Chronic physical illness in childhood or adolescence may predispose an individual to this disorder. OCPD is characterized by a need for things to be orderly and perfect. One might consider this behavior as normal. Onlookers might say this individual is controlling or has high standards. Individuals diagnosed with OCPD are also considered to be extremely frugal.
Personality disorders and their impact on occupations. Cognition. Affected by the distortions in the way one thinks and interprets the world, as well as how they think about themselves and others. Affectivity. Those diagnosed with a personality disorder often come across as constricted, cold, or indifferent. They can also be characterized as dramatic and having intense patterns of irritability, anger, and explosiveness. They also have problematic emotional response patterns such as range, intensity, and the appropriateness of a response. The next is impulse control problems. One's inhibition can be significantly limited, and therefore one's willingness to try new things is hindered, leading to something called over-conscientiousness. There is also a lack of self-expression, problem-solving, spontaneity, and fun. The last is interpersonal problems, which could be problematic thinking, feelings, and behavioral problems that tend to create a negative impact on the individual's ability to participate in purposeful occupations and the ability to maintain healthy, meaningful relationships. Personality disorders, prognosis, and medications. The prognosis. Personality disorders are difficult to treat because it's difficult for someone suffering from one of these disorders to separate their personality from the symptoms of their mental illness. Furthermore, people with this disorder might not think that there's a problem with their behavior or way of thinking. Medications include anxiolytics or anti-anxiety medication, neuroleptics or antipsychotics, as well as mood stabilizers and antidepressants. Some assessment tools and treatment interventions. Clinical interviews, personality assessment schedule, NEO 5-factor inventory, and questionnaires are all used as possible assessment tools. Some treatment interventions include CBT, anchor management, DBT, meditation, psychoeducation, support programs, and re-entry programs.
The frames of reference include PEO model, cognitive behavior model, behavior modification, and modal model of emotions. Group therapy includes structured task, expressive social skills training, psychoeducation, vocational educational training, social participation, functional living skills, and medication management. And these are our references.